Good evening. Welcome to a Pineapple Night Studio Productions. Anyway, so I will try to share my experience with parents of severely autistic children and children with autism. That's at this point it doesn't really matter. But what I'm going to be doing is it, providing parents some support and help how to teach them to point. And this is a primary skill. It's very important to have that skill because if you teach them something like point at the girl, point at the boy, that's something they already should know how. That's why it's important. And this technique I'm kind of like modifying myself. And there's some of it is occupational therapy, some of it is something different that you probably never ever heard before in your life, but maybe some did. And just take a look at that therapy. It's called MNRI, right here, MNRI. And it stands for Mozgotovo Neurosensory Motor Reflex Integration. That's a Russian doctor, created, PhD doctor with research, created this therapy, and that addresses autism and people that survive like a physical trauma and recovering. But take a look at Dr. Svetlana Mozgotova. She is a PhD doctor, developed her program and treatment, and she does have training. We were receiving this therapy until the COVID hit us all, right? And I think we were receiving this when my child was still potty training, so I think that helped a little bit with our issues, because it's basically helping individuals to mature reflexes, because some of them just kind of stay afloat, and that specific there. So what I'm taking parts of it, what we did, and applying this to teach pointing. And pointing is actually an action, it's not a word, so it's going to be physical approach, occupational therapy. Now, so we've done with MNRI. Sorry. All right, so I go one by one. So we're gonna put this as default that you overcame already finger sensory, because we had that too. And when my child, for example, when he touches something and he just feels like disgusted, and then he starts, and he still does it, by the way, but I'm teaching him to use napkin instead, right? Typical and appropriate behavior. But if he got something, he's trying suddenly like get rid of that, and like they play dough, or like there's other things you can do to desensitize the fingertips. So let's say that this is in place, and yes, desensitizing fingers, you want to try it like a jelly balls. You put them in the water and they get bigger, and that's what they really love to play with. That's for finger sensory. And there's also Fun and Function website where you can go and look. They use some of the cans for occupational therapy, where you have to dig some certain items or animals or beads, whatnot, from that sticky gluey stuff. And they also have range or grade, softer and medium and harder. So where you start with the soft, obviously, and then they once they get their fingers strong and desensitized, they can pull these items out of much harder clay or whatnot, whatever. So this is just some of the things where you pretty much address the fingertip sensor, because my child had that as well. So, and he's still it's a little better now though. Then we have also fine motor dyspraxia. Fine motor dyspraxia, basically my child is not able to hold the pen. He would hold it like around, although he did learn how to open a door lock with a key. So depends, but holding pen, he could never get to it, so I taught him that as well. And we're still kind of struggling with the spoon, but right now he's eating, so it just needs shaped up, and I don't want him to be upset or get these behaviors on the rise when I do that. So I just don't even touch that yet. He's feeding, okay? He's just not like comfortable, appears to be, but who cares, right? At this point, he can do it independently. And that's what really matters. Because all of these things, when you put them in place, they have to be done gradually, and gradually means takes time, takes attempts, over and over again, repetition. So when you do this, desynthesize their fingers, then you can do with fine motor, work with fine motor. Let's see. And so I've used some of that MNRI approach. And when you do that with their fingers, you want to make sure you address both hands. Well, for one thing, we don't know right or left. I already figured it out. My child actually right-handed, but we don't know until they start actually holding pen or spoon. You know, we don't know because we do that for them, right? That's why you want to do both hands, and it's actually better too because you kind of balance out the sensory on both hands immediately or simultaneously rather. Now, this is the skill that we'll be addressing visual, auditory, and physical, right? Because they're gonna be seeing the symbol or the PEC card. They will be hearing that from you. They may not be able to say, but they will hear, they understand that there's nothing wrong with the hearing, they're just nonverbal. And then the physical, they actually have to roll these fingers that don't work, right? They have to roll them to this position here. So so these are the three ways they're gonna learn that. It's not just visual, auditory, it's gonna be also physical. And the words can be used when you do that specific training would be the right, the left, massage, hand, and actually the word point. I'll use these words with him just to show you, but this is basically vocabulary. If they don't know this is a good thing or the good point to start using these words. And yes, you do want to have, like I just draw that one, this is basically a pair card that you do want to have because this is visual prompt for them to show them what needs to happen with their hand right here. So let's just see how that's gonna go. Again, with my child, I just never know. All right. Okay. Brandon. Mom, выключи laptop. Brandon, let's do massage. He's my mother's on iPad and watching whatever game, and he wants to see that. So that's going to be a distraction number one. I have to get him off. Brandon, let's do massage. And I already trained him that massage is something pleasant and he likes it. And now he even asks for it. So I'm going to just give him a little bit more feedback. Okay, sit down. We're going to do massage your hands. Sit down. No, not on me. Come on now. Okay, now turn the phone, or you can make it louder. So we're gonna show. Okay, so he's giving me his. Okay, Brandon, what hand is that? What hand? What hand?
My skirt.
Okay, he cannot say.
Go.
It's kind of sad you're gonna see only me, but I want you.
Go.
I hope it doesn't fall on me.
Go.
Okay, Brandon. Yes, I know the girl. Now look, is this what hand is that? And this is not very. It's very difficult for him.
Boy.
Yeah, that's distraction at this point. Okay, now I'm gonna prompt him. Brandon, stop. Is it right or left hand?
Right or left?
Left. What is this one?
Right.
Right. So because see, when it's like what hand is that? Oh, he doesn't know. Be more specific. And this is how you have to be with this children. Sit down, please. Sit down, please. We're gonna do massage. Remember? And this is what I do. I'm gonna go basically rubbing all his hands, and he seems he likes to pull in the skin. And I showed him today. I said, do you like your skin being pulled? I mean skin pull, and I'm showing a skin pull, and then I go massage, and then I go scratch. So he knows 3 different things that can be done, and he seemed to like that pulling skin actually feels good on him. And this is how I know. I just pull it and I say skin pull, and then he says more, or I say massage. And so we're gonna just basically rubbing up. And as you know, like in athletics, like gymnasts, let's take gymnasts as an example, they don't ever do splits without stretch. they need to stretch a little before they do that. And this is what you do, you warming them up, especially those that like we are. Fine motor dyspraxia, he couldn't even roll his fingers, but see what I'm doing, and this is more like a deep touch massage at this point. That's my approach, and you know, I'm going all the way to the full arm actually. And now we're gonna do MNRI, Dr. Mazgudova approach, and this is what I do with this one. Brendan, put this hand down please, because you got the view. So what we're gonna do here is we're gonna start with either one, either this way, but I think this is better, or you can start, it doesn't really matter actually. So, and you just rub each finger like that. This is Mazgudova, okay? This is what I'm doing here. And then you just pull, and that's me now. And you're gonna bend like that. Then you start with a small finger here. I don't know all of the names, I'm sorry, it never really bothered me not to know, I mean. So you just kind of rub, and you make that triangle with your fingers, and you rub, and then you pull that finger, okay? And then you bend it and you hold it in place, and he's prepared for the next. See, then we're gonna do again, you're gonna, when you push on the finger, you're gonna feel like it's like a triangle position here. And you rub the whole finger, and then you pull it, and then we're gonna bend that one too, okay? He's ready for the next. He's showing me, yeah, he's showing me that, but that's in the autism world. It's not what it is. So, and then we just rub, and then we're gonna pull that finger, and we're gonna bend that one too. Look what we got left. Right? We've got what we need, and we're gonna again wrap that finger with your fingers in the shape of triangle. You're gonna feel it with the 3 fingers. Just keep rubbing and rubbing and rubbing and rubbing and rubbing. Look, he calmed down. He's not even, you know, listening to his video, DVD, whatnot. And so, and then we have that. You know, just for the purposes of video, I'm not gonna do 2 hands, but you wanna do 2, okay? And now we have already preset right there, right? Now we're gonna hold these. And see, he has tendency to roll that finger. It's just nature, but I'm working on it. And you want to put some pressure like this. See, he cannot do much. And then Brandon, point. That's okay, you don't have to point, but this is where you're gonna point. And you got your cards, because we're teaching them action, and we're teaching them what the point is actually by itself. So we're gonna point. Where's the girl? What do you want?
What do you want to do a massage?
Yes, of course he wants massage. See, he now wants massage because he knows it actually should feel good. And but you already stretch these fingers, you roll them for him, and you're just gonna say point at boy, and you're gonna, you know, I don't know where you are, but if you don't know, you're just gonna boy, point, and then you have this card here, because they're non-verbal. You're gonna take that pet card. I'm sorry, you don't see that. So you're taking that card, it's a sexual point. And yes, I forgot to mention, you want to have a drawing and you want to have a word next to it, so they learn both an action and a word, and they may not say it, but they will always recognize it. And when you show them that card, let's try it. Brendan, let's see, point at the boy. I'm gonna point like that, okay? And yeah, he's not doing this right now, by the way. Brendan, point. You're gonna point like this. And I'm also sure I'm using my own body to teach him. And actually, when I told him the difference between right and left, I actually also looked if he can even roll his left, and he can, because I've done this massage to both hands, but I already know he's right-handed. Brendan, then you're gonna, you can apply that sometime when they're somewhat skilled, desensitized. Yes, good job. Can you point at girl? Point at girl.
Go.
This finger, use this finger.
Go.
Yeah, point,
Go.
point. Okay, now do you want more massage?
More massage.
Yes, and he does want more massage. And look, he's not watching his video right now because this is all you do. Just prepping, and that does something for them. Dr. Masguda will give you more feedback what it does, but it works for me, I think. And I'm stretching these fingers. I'm kind of already pre-setting him up for that hold, hold itself. So I'm gonna bend, and we're gonna do this finger, and the fingers are ready and stretched. Then you take in their hand and you say point. And sometimes you teaching them, you showing them this fact. No, sit down. That's what I'm talking, right? You want to also use your own body and say something when they know the word or may not know the word. You just say, Brandon, watch. Do this. Do this. Look at me. Do this. Can you do this? And he's confused because he knows what, I'm asking him point, right?
Go.
So that's a level below.
Boy.
Yes, but that's distraction too. Brandon, do this. Yeah, do this. Can you do this? Can you do this? Point. Can you do this? Yes. I had the cards like that where you would teach him direction and stuff, and you just eventually you just point. Show me this, Brandon. Can you do that? That's hard. It's just very hard. Brandon, can you point? Point. Make your hand like that. Point. And he cannot do this, so I'm gonna help him. I'm gonna point. 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 Yes, good job. Now, can you do that?
Go.
Yeah, not on. That's distraction. I totally have to hide this. Okay. Now I need to switch the task. Sit down. And I have to give him something he already knows, and then go back to pointing. Brendan, stop. Okay. Now, Brendan, can you do this? Can you do this? Can you do this? Can you do this? Good boy. Did you see that? That's how that works, because he already learned the word point. So why would I ask him do this, do that? Anyway, I think I'm pretty much covered what I needed. I have to get on that appeal case I have next, and I hope that was helpful. And what happens then, you will just keep doing this consistently, and you're just going to be doing massage, have those fingers roll to that level, because again, they just cannot do it. It's just disability in a way. And even if you look at the sporty people, they don't just start running marathons, not at all. They actually prepare, they do exercise, they do stretch, and this is what we need to. We kind of warm them up. But that Masgudova, he liked it, and he would certainly take the second hand for me to do. But you want to do both, and then you just shape that when it does, comfortable enough, then you can just start using that finger. And then you show him the actual pack card, which is that one, right? Because they need to recognize that. You may use this sometime alone when you teach them something else. You just take the card and say point. And then you take their own hand, and because they have to make that hand roll that way. Then point. And then, yeah, he was definitely pointing, we're already a little bit advanced, so that's kind of hard for him too, like, do this. He already knows that, pointing. I was like, what am I doing here? That's why I was like, do this, do what they know what to do. And then you bring them back where they need to be again to kind of regain everything, okay? I hope that's been helpful. If you have some questions, let me know. I just bought a book, Dr. Masgudova, today, and I'll share with you if it's worth buying. But it's something good to look at. and see if that works for you, because we all start somewhere at the zero. Okay, talk to you soon.